clinical issue is the rate of infection associated with central lines. CLABSI is a threat to our patients because the catheters for the central lines are vulnerable to infection and they lie close to the heart.
Our PICO question is, in patients with central venous access catheters, what is the effect of closely following and monitoring a currently accepted protocol, such as those consisting of strict blood culture procurement criteria, implementing chlorhexidine bathing and dressings, use of alcohol-impregnated caps, and routine central venous catheter changes in comparison with other currently accepted protocol on the rate of central line-associated bloodstream infections?
This issue is important to nursing because nurses are constantly in contact with the patient. This issue has a negative effect on patient outcome, and it's important for us as student nurses to learn how to prevent central line-associated bloodstream infections.
Some keywords that we use for our search include central line-associated bloodstream infection, protocol, practices, and prevention. We also use some of the search terms that the various databases suggested as commonly used words in their headings. These include guidelines, intervention, and CLABSI. The databases we used were CINAHL and Medline. Some limitations that we used for our search included that it must be published within the past 7 years, must be in English, and it must be a peer-reviewed article.
Our group examined 4 articles, with the overall quality rating of 2B. These studies took place in hospitals and had a variety of patient populations, including burns and other intensive care patients, although all of these patients had central lines. While many of these protocols varied on the specific interventions or bundles, all of our articles had evidence supporting implementing a bundle of interventions with consistent interprofessional monitoring. Overall, our evidence was good, but was inconsistent regarding specific protocols. We did, however, have good, consistent evidence recommending the implementation of bundled interventions, including alcohol-impregnated caps, which are monitored and audited by interprofessional teams.
There's always room for improvement, but a large-scale practice change is not currently recommended based off of our research. Across the hospital, current practice is in place with what our evidence suggests is, in fact, best practice. Here is an example of what UCMC has in place for CLABSI prevention.
If our hospital and others like it begin to or continue to implement CLABSI prevention bundles, including using alcohol-impregnated caps, there could be a significant decrease in CLABSI rates and a subsequent increase in positive patient outcomes.